Epidemiology and Public Health in Dermatology. Introduction. The study of epidemiology is concerned with the health of populations and helps to inform not only the natural history and treatment of disease, but also the public health policy of a disease. Understanding a disease includes not only identifying the cellular, genetic, and molecular causes and consequences of the illness, but also assessing how the disease affects patients and the population in which they reside. Because the techniques of an epidemiologist are often the basic science of evidence-based medicine, as a practitioner of dermatology, a good foundation in epidemiologic cutaneous science is as important as understanding the molecular basis of skin disease. Basic concepts. Clinical trials are interventional studies that include randomized controlled trials, RCTs. Health services research evaluates how an individual receives health care and interacts with the healthcare system. Patient-oriented research most commonly refers to studies of how patients interact with their health care and disease. The natural history of disease is the course of the disease from its onset until its, or the patient's, end or resolution, the latter of which may be study outcomes of interest. The burden of disease is a measure of how an individual is affected by an illness. An outcome is the observation of primary interest. An intervention is the application of a substance or an action to subjects in an experimental study. A risk factor is an attribute that increases the likelihood of developing a disease or other outcome of interest. An association occurs when an attribute or other factor is found to be related to an outcome of interest. Bias is a systematic error that causes the results of a study to deviate from the truth, which includes selection bias and information bias. Selection bias is a systematic error in a study caused by how subjects are selected or not selected for a study. Information bias is bias that occurs because of reporting. Confounding occurs when two risk factors or exposures are associated with each other and the outcome of interest. Efficacy is the measure of an effect in an ideal setting. Studies that measure efficacy are called explanatory studies. Effectiveness is how well an intervention works in the real world. Comparative effectiveness refers to studies that compare two or more treatments that are generally accepted to be effective. A cohort is a group of people. This is epidemiologic study designs. Experimental studies. Experimental studies are those in which subjects receive an active intervention, that is, drug or other treatment. Clinical trials are the most commonly used and recognized of the experimental studies. Phase 1 studies are the first studies performed in humans and are often designed with the notion that they are human pharmacology studies. The goal of Phase 1 studies is to evaluate a drug's dose range, safety, tolerability, pharmacokinetics, and pharmacodynamics. Phase 2 studies are also called initial efficacy studies and are conducted to initially determine the effect of an intervention on patients with the disease of interest. These studies are also conducted to obtain additional information required to properly design Phase 3 trials. Phase 3 studies, also called comparative efficacy studies, are designed to assess the efficacy of an intervention compared with that of a control treatment, either active treatment or placebo. Phase 4 studies, or post-marketing studies, are usually conducted after a treatment obtains FDA approval for marketing. They may also be called effectiveness studies because of their focus on how well the approved drug works in the general population and how safe the drug is in a larger population and over a longer period of time. Differences between efficacy and effectiveness research. In ideal setting, stringent patient selection criteria to optimize safety. In the real world, heterogeneous patient population more susceptible to adverse events. In ideal setting, highly motivated patients with strict adherence to research protocol, but in the real world, variations in patient motivation and ability to adhere to prescribed regimen. Observational studies. Observational studies are those in which subjects are observed and exposures and outcomes are measured in routine care. The most common types of observational studies include cohort studies, case control studies, and cross-sectional studies. A cohort study, sometimes called a prospective study, follows a cohort group of patients over time and monitors the effect of a risk factor or exposure on the development of an outcome. A case control study is sometimes also called a retrospective study. These studies sample a group with a disease of interest cases and another that does not have the disease controls. Meta-analysis. A meta-analysis is a quantitative study of studies. It is a systematic review that attempts to combine the results of multiple studies in order to create a pooled effect estimate of an outcome of interest. Meta-analyses may summarize experimental or observational studies. By combing multiple studies, the meta-estimates are often more precise than the individual estimates in the original studies. Descriptive studies. Descriptive studies are designed to report the distribution of disease or other health outcomes in a population. Descriptive studies may include case reports and case series that provide a detailed profile of single or multiple patients observed in the clinical setting. Cross-sectional studies may also be descriptive. Quality reporting and assessing evidence levels. Standardized recommendations for quality reporting and levels of evidence rating scales can aid in the interpretation of epidemiologic studies and clinical recommendations or guidelines, respectively. Measures in epidemiology. Descriptive measures include prevalence, incidence, and duration. Measures of association include risk ratio or relative risk, attributable risk or risk difference, and odds ratio. Measures in epidemiology. Test characteristics are sensitivity, specificity, positive predictive value, and negative predictive value. This is the 2x2 tables for sensitivity and specificity. Measures in epidemiology. Patient-reported outcome measures. Generic measures of overall health or quality of life, QOL. Several PROMs are specific to dermatology, including the skin-related QOL instruments Dermatology Life Quality Index, Skindex 29 and Skindex 16, as well as several condition-specific. Example patient-oriented eczema measure and symptom-specific, example ItchyQuant tools. These are the examples of instruments used to measure patient reports. Conclusions. Epidemiology forms the basis for advancing our understanding of disease among populations. Epidemiologic, patient-oriented, and health services research is essential for furthering our knowledge of dermatologic diseases at both a population and individual level.